Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're diving into part 79 of our health series focusing on metabolic syndrome, the cluster of conditions. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this crucial information. Today, we're going to unpack the complex health issue that is metabolic syndrome, a cluster of conditions that increases the risk of heart disease, stroke, and type 2 diabetes. Metabolic syndrome is not just one condition, it's an orchestra of health issues playing together, hitting the wrong notes in your body and creating a cacophony of potential health risks. Picture an ensemble of conditions, each with its unique tune, but when played together, they amplify the risk of serious health challenges. This ensemble typically includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. When one or more of these conditions occur together, they form the band known as metabolic syndrome. Now, you might wonder, why should I care about metabolic syndrome? Well, it's a global health concern, affecting millions of people across the globe. It's a silent threat that creeps up on us, often unnoticed until we're faced with heart disease, stroke, or type 2 diabetes. But here's the good news. Metabolic syndrome isn't a life sentence. In fact, it's a wake-up call, a signal that our body needs some TLC, tender loving care. And that's exactly what we're going to discuss in this series. We'll delve into various strategies that can help manage, prevent, and even reverse metabolic syndrome. We'll explore dietary changes, regular exercise, weight loss strategies, the role of medication, stress management techniques, the importance of good sleep hygiene, the potential of intermittent fasting, the use of supplements, and the crucial step of smoking cessation. We'll weigh the pros and cons of each strategy, providing real-life examples to help you understand their impact. But remember, every body is unique, and what works for one person might not work for another. Our aim is to provide you with a spectrum of strategies, so you can choose what resonates with you, what fits into your lifestyle, and what can help you reclaim your health and vitality. With that background in mind, let's dive into the first strategy: dietary changes. Firstly, let's talk about the role of diet in managing metabolic syndrome. Diet is a crucial part of the equation. A healthier diet can have a profound impact on the various components of metabolic syndrome. It can help regulate blood pressure, lower cholesterol levels, and improve insulin sensitivity. However, it's not a one-time fix. It requires consistent effort, and for some, it can be challenging to maintain over the long haul. Let's take the example of John. At the age of 45, John decided to make a change. He adopted a Mediterranean diet rich in fruits, vegetables, whole grains, and lean proteins. Within a span of 3 months, John saw significant improvements in his blood pressure and cholesterol levels. His experience shows us that dietary changes, while requiring dedication and perseverance, can indeed significantly improve the components of metabolic syndrome. Just like John, making dietary changes can significantly improve the components of metabolic syndrome. Moving on, let's discuss the importance of regular physical activity and weight management in tackling metabolic syndrome. When it comes to managing metabolic syndrome, exercise is a critical tool. Regular physical activity helps improve insulin sensitivity, which is often impaired in individuals with this condition. Furthermore, exercise aids in weight management and boosts cardiovascular health, both of which are vital for those dealing with metabolic syndrome. Sarah, a 50-year-old office worker, is a shining example of how beneficial exercise can be. She incorporated 30-minute brisk walks into her daily routine and noticed a reduction in her waist circumference and an improvement in her energy levels in just 2 months. However, as with any lifestyle change, regular exercise requires commitment. It can be challenging to start and maintain, especially for those with busy schedules or physical limitations. In addition to exercise, weight loss plays a significant role in managing metabolic syndrome, especially for those who are overweight. Reducing body weight can dramatically improve all components of this condition, from blood pressure to insulin sensitivity. Take Mike, for instance. At 52, he lost 10% of his body weight through diet and exercise. This led to normalized blood pressure and improved glucose tolerance. However, just like exercise, weight loss is a journey that requires long-term commitment and can be challenging. However, the examples of Sarah and Mike provide hope. They show that with dedication, it is possible to make significant strides in improving one's health. They remind us that every step, every decision towards a healthier lifestyle, no matter how small, counts. While the journey to better health may have its challenges, the rewards are well worth the effort. Improved health, increased energy, and a reduced risk of serious health complications are just a few of the benefits that come with regular exercise and weight loss. As Sarah and Mike have demonstrated, physical activity and weight loss can be game changers in managing metabolic syndrome. Now, let's explore other strategies including medication, stress management, and sleep hygiene. First, let's discuss medication. Like Linda, many people find that medication can effectively manage individual components of metabolic syndrome. Under her doctor's supervision, Linda began using a statin. And within 6 weeks, she saw a significant reduction in her LDL cholesterol levels. However, it's important to remember that medications may cause side effects, and they don't address the underlying lifestyle factors contributing to metabolic syndrome. Next up is stress management. David's story serves as a great example of how effective stress management can be. When he incorporated daily meditation into his routine, he saw improvements in his blood pressure readings after just 1 month. However, stress management requires consistent practice and may not show immediate results. It's a long-term commitment, but as David's case shows, it can have a positive impact on metabolic syndrome. Finally, we have sleep hygiene. Ensuring you maintain good sleep hygiene can greatly improve overall metabolic health and assist with weight management. Emma, who prioritized 7 to 8 hours of sleep nightly, noticed improvements in her insulin sensitivity and reduced food cravings. However, maintaining good sleep hygiene can be challenging, especially for those with busy schedules or sleep disorders. In sum, medication, stress management, and sleep hygiene are all viable strategies for managing metabolic syndrome. They each come with their own set of challenges, but as seen in Linda, David, and Emma's stories, the benefits can be significant. With the right approach and the right support, these strategies can make a big difference in managing metabolic syndrome. As seen in Linda, David, and Emma's cases, these strategies can offer substantial support in managing metabolic syndrome. Lastly, let's delve into the roles of intermittent fasting, supplements, and smoking cessation in controlling metabolic syndrome. Intermittent fasting, a pattern of eating that alternates between periods of fasting and eating, has shown promising results in improving insulin sensitivity and aiding weight management. However, it's not a one-size-fits-all approach and requires careful planning. Just take Robert, for example. At 51, Robert adopted a 16-hour fasting and 8-hour eating schedule. After sticking to it for 3 months, he experienced improved blood sugar control, a significant step in managing his metabolic syndrome. Now, let's talk about supplements. While they shouldn't replace a healthy diet and lifestyle, certain ones like omega-3 fatty acids may help improve metabolic health. But remember, their effects can vary. Consider Susan's story. At 49, she added fish oil supplements to her regimen. After 2 months, she saw a modest improvement in her triglyceride levels, a component of metabolic syndrome. Lastly, we have smoking cessation. Quitting smoking has countless health benefits, including reducing the risk of cardiovascular complications associated with metabolic syndrome. However, it can be incredibly challenging and often requires multiple attempts. Take Tom, for instance. At 53, he quit smoking with the help of nicotine replacement therapy. It wasn't easy, but the impact on his overall health was undeniable. As Robert, Susan, and Tom's experiences show, these strategies can also be instrumental in managing metabolic syndrome. In conclusion, managing metabolic syndrome involves a comprehensive approach that includes a healthy diet, regular physical activity, weight management, proper medication, stress management, good sleep hygiene, intermittent fasting, supplements, and smoking cessation. We have explored various strategies today, each with its own advantages and challenges. From dietary changes that can significantly improve all aspects of metabolic syndrome, to regular exercise that boosts cardiovascular health, we've also discussed the importance of weight management, the role of medication, the impact of stress management, the benefits of good sleep hygiene, the potential of intermittent fasting, the contribution of supplements, and the necessity of smoking cessation. Each strategy is a piece of the puzzle in managing metabolic syndrome. Remember, the journey towards better health is a marathon, not a sprint. Every step you take towards these strategies brings you closer to a healthier life. Before we conclude, I'd like to emphasize that the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your health is important, and professional medical advice is crucial for managing metabolic syndrome effectively. Thank you for joining us today at the Victory Education Lounge. If you found this information helpful, please like, share, and subscribe to our channel. Don't forget to leave a comment below sharing your thoughts or experiences with metabolic syndrome. Your story could inspire and help others on their journey to better health. Until next time, this is Maurice wishing you health, happiness, and victory in your metabolic health journey.